Congress Chair Professor James Barlow, Professor Delany, Professor Joseph Song, Honorable Ministers and Ministerial Delegates, distinguished guests, ladies and gentlemen. It gives me great pleasure to join you today at the 11th World Congress on Design and Health. I would like to take this opportunity, firstly, to congratulate the organizing committee on holding this year's Congress, and on behalf of the Hong Kong Special Administrative Region Government, I would like to extend my warmest welcome to all of you, in particular to all our guests from overseas. Thanks to the dedication, commitment, and expertise of our healthcare professionals, Hong Kong is privileged to have a world-class healthcare system. It runs on a dual-track basis, encompassing both the public and the private sector. The public healthcare sector in Hong Kong, which takes care of some 90% of inpatient services, is the cornerstone of Hong Kong's healthcare system and provides a safety net for all. The government of Hong Kong has all along upheld its firm commitment to the public healthcare sector and strives to ensure that no one will be deprived of medical treatment because of lack of means. With the rapidly aging population and increased aspiration for healthcare services in Hong Kong, the demand for quality services is high and will be even higher in the coming years. In 2014, the proportion of elders aged 65 or above in our population is about 1 in 7. This will become about 1 in 3 by the year 2041. We are therefore well aware of the present need to increase the overall capacity of the healthcare system in Hong Kong to cope with the rising service demand. Confronted by these challenges, the government will continue to strengthen our investment in the public healthcare system and continue to enhance the capacity of affordable healthcare services for the benefit of the community. In recent years, we have been taking forward a number of major capital works projects to help meet the community's long-term healthcare demand. This includes the development of new hospitals as well as the expansion and redevelopment of existing hospitals. Capital expenditure for the projects under construction or soon to be is estimated at over Hong Kong 80 billion, contributing to an increase of 2,800 beds. Amongst the many hospital projects, the construction of the Hong Kong Children's Hospital, which commenced in the year 2013, marked an important milestone in the development of healthcare services in Hong Kong as the first of its kind in the territory, and also as part of the development of the overall healthcare system and infrastructure for Hong Kong. This is also an important step forward in the provision of quality pediatric healthcare services and a testimony to our commitment to invest in health and well-being of our future generations. We have also formulated a blueprint for public hospital development and redevelopment to further enhance our service capacity for the future. For instance, we are proceeding with the development of a new 2,400-bed acute hospitals in the Kai Tak New Development Area in order to meet the long-term healthcare need arising from the changing demographic needs of the residents in the Kowloon region. When fully developed, The hospital will provide clinical services of major specialties, including accident and emergency services, and it will also house a state-of-the-art neuroscience center to provide specialty services in the area of neurological diseases. Furthermore, a number of other existing major hospitals, including the Queen Mary Hospital, Kwong Wah Hospital, United Christian Hospital, Kwai Chung Hospital, etc., will be redeveloped with or without expansion. Because of a limitation in space and footprint, most of these redevelopment projects are to be planned and executed in situ. The establishment of the first of its kind specialty-based hospital, that is the pediatric hospital, a mega-scale acute general hospital incorporating the neuroscience center, and that is the Kai Tak Hospital, as well as the redevelopment in situ of several major hospitals with ongoing service provision, have all posed unprecedented challenges to the capital project management capability of the Hospital Authority of Hong Kong. In designing new hospitals and redeveloping existing ones, we are mindful that we must take into account patients' future needs in an aging society and advance in medical technology and its impact on the delivery of hospital care. We are grateful to the Architectural Services Department, whose architects have helped us incorporate many innovative ideas to tackle the challenge of an aging population. New design concepts, such as improved accessibility, especially for the increasing number of patients using wheelchair in future, provision of additional space for installation of advanced diagnostic equipment in the accidents and emergency department and operation theaters, more circulating areas in the ward to cater for the increased use of information technology and portable digital equipment in the treatment process, and more emphasis being put on ambulatory care will also help to provide better care for the patients, promote new service delivery models, and optimize the efficiencies of hospitals to help cope with the demand. We will continue to work closely with our partners in the architectural services and related disciplines, as well as to learn and share with our international counterparts to ensure that our hospital development projects will be brought to fruition successfully, but within the very tight time schedule and prescribed fiscal allowance. I should perhaps also mention at this juncture that when I met Professor Joseph Song this morning, it actually reminds me something occurring in Hong Kong 12 years ago, and that is the SARS outbreak in the year 2003, as well as the recent outbreak of Middle East respiratory syndrome. All this serves also to remind us that apart from the non-communicable diseases and the aging population, the importance of facilities provision, standard, and design in the management of infectious disease outbreak. I believe Professor Song later will also touch on the other aspects of our city designs and and demonstrate how the design and perhaps the building service work of a residential facility can also facilitate the spread of infectious disease. Ladies and gentlemen, the fast-growing socio-economic environments in the 21st century with a rapidly aging population presents challenges to Hong Kong and the rest of the modern world alike. The health sector cannot act alone to tackle these challenges. There is a need to ensure that cities are designed and built in a way that the physical and socio-economic environment ameliorate the new urban health risks and ensure the operational safety, clinical outcome, and financial sustainability of healthcare facilities now and into the future. I would like once again to congratulate the organizing committee for its success in organizing this event, and I'm glad to see that this year's Congress has an extensive program composing of different special topic sessions, exhibitions, and panel discussions on new challenges and future directions in health design, green building, and sustainable healthcare design. I'm sure the Congress can serve as an invaluable platform for experts and colleagues all over the world to exchange ideas and showcase the most innovative research findings in the field of design and health infrastructure. I would also like, again, to take this opportunity to congratulate the winners of the 2015 Design and Health International Academy Awards. Your achievement in and contribution to promoting a healthy society is well recognized and fully appreciated. Before closing, let me express my sincere gratitude to everyone here for your dedication and devotion to building a healthy society in Hong Kong and worldwide. I also like to wish those who have traveled afar a wonderful experience and President's Day in Hong Kong, and thank you very much.